Good evening. It's Thursday, March 19th, and my name is Dr. David Park. In this brief video, I will provide you with some information to hopefully give you a better understanding of where we are currently in the situation of the global COVID-19 pandemic. I understand that there's a lot of uncertainty and confusion in the community because people are getting their information from various news outlets and social media, and hopefully this video will provide you with some good information and clear information of where we are in the medical community. First of all, this coronavirus disease of 2019, which is labeled COVID-19, is caused by a virus that we call SARS coronavirus 2. Now, if you're wondering what the coronavirus 1 is, that was the SARS epidemic that occurred in 2003, the first epidemic of the 21st century, and that was caused by the coronavirus 1. Now, I know that people have been comparing this current coronavirus with influenza, and so I'm going to use some statistics and information from the CDC about the influenza, which we call the flu, so that you can get a better perspective of where we are with COVID-19. Now, according to the CDC on their website, in the current influenza season, which started October 1 of 2019 to March 7 of 2020, so less than 6 months, it is estimated by the CDC that there have been up to 51 million illnesses associated with that influenza virus, which ultimately resulted in up to 55,000 deaths. Now, these are CDC estimates in just this current time period of less than 6 months in the United States. The coronavirus causing the COVID-19 problem here is significant. And it is scary because there's these numbers that are out there that shows mortality rates of up to 8.3% in Italy and as low as 1.1% in South Korea. But these are significant numbers because they are significantly higher than the 0.1% estimated mortality rate of influenza. Currently in the United States, the COVID-19 mortality rate seems to be about 1.4% at the time of this recording. And currently, according to the CDC, there's over 10,000 confirmed cases of COVID-19 in the US. And according to the Johns Hopkins live coronavirus tracking map, we're over 13,000 at this time. Now, if you're talking about a 1.4% mortality rate of COVID-19 in the US, that is 14 times more deadly than the influenza virus. Now, these numbers are scary, but they are also misleading. The numbers that are being reported right now are the confirmed cases. We believe that there are significantly many more people that are infected with coronavirus 2 that are just not confirmed. And they are not confirmed because they just weren't tested. We are having national problems with supply for the COVID-19 testing kits, as well as significant problems in the logistics of getting people tested. And people that are getting tested, we are not getting their results in a timely fashion. So we believe that there are many more people that are infected with coronavirus, and they are just not confirmed at this time. So this is why it is so important, and why we are in a really an act of solidarity. This nation has really mobilized everyone to encourage them to practice extreme measures of social distancing and self-quarantine, having schools and businesses close their doors so that they can deliver their products and services and education online or other methods, because we are really trying to prevent the person-to-person transmission of this disease. We do believe that this SARS coronavirus 2 is significantly more virulent, which means more harmful, and also more easily transmitted than the influenza virus. This is why we have to practice these measures of seriously and thoroughly washing our hands frequently, using disinfectants frequently so that we don't transmit. Now, this transmission can occur via airborne. It can occur from respiratory droplets, and it's scary because we know that this virus is able to live live on surfaces for hours and potentially up to days, which means that you can touch something and then touch your face and then get this infection. Now, we say don't touch your face because this virus goes through into our system through our mucous membranes. That's our eyes, our nose, and our mouths. It is so important that we practice these measures to prevent the fast spread of this virus, because we have learned from our medical community partners in Italy that this can overwhelm the system, and they are giving us warning to act seriously and act fast to prevent that from occurring. You have heard this talk about flattening the curve. What we're trying to do is trying to mitigate the spread of this disease over a longer period of time, as opposed to a great exponential spike, because if that occurs, that will overwhelm our healthcare system. Understand that currently in our healthcare system, there are many providers, healthcare workers that are now getting exposed and infected with coronavirus too. And so now they have to isolate and self-quarantine themselves. And this will continue to occur. And what this means is that this will continue to decline our current healthcare workforce to take care of the people that need to come to the hospital. This is why we are asking everyone to stay at home, try not to go out, do not get infected, and we don't want you going to the hospitals until you're very sick or you need medical attention. Our ERs in the hospitals all across America are busy as it was, with regular emergencies of fractures and infections and strokes and heart attacks. Adding this on top of that will truly overwhelm. Now, I don't want to cause panic and cause any increased fear, but I do want to stress that this is a serious national problem and an international problem, that we must do our part to fight this infection, this pandemic of COVID-19. I ask that you remain vigilant, that you remain extremely cautious, and that you remain safe.